Today I have with me Professor Dr. Ravi Wankhedkar. He is a surgeon in Dhuli in the state of Maharashtra in India, which is currently the hotspot for the COVID-19 pandemic. Dr. Wankhedkar is at the same time the treasurer of the World Medical Association, but he is also the president of the SAARC Medical Association, and he has been the national president of the Indian Medical Association. Dr. Wankhedkar, this is now the first day of the lockdown in India. How do the people feel about this?
Thank you, Dr. Otmar. In fact, the national lockdown, the trial had already begun for last 1 week. We were slowly geared up by these various state governments who had announced partial lockdown step by step. Hence, the response is very good. Our Honorable Prime Minister did a voluntary curfew on 22nd March for 14 hours, which was very, very successful, and thus prepared the background and the psyche of the population for lockdown.
That means the people are in agreement with that, so most people accept this lockdown?
99% realize that this lockdown is essential for further stopping the progression of corona crisis.
And India is still in a pretty early phase compared to other countries in this world. Is that correct?
Yes, though we are not in an early phase. First case was detected on 31st January. Our progression, like this epidemic follows the pattern, has really picked up in last 10 days, where every 5th day we are doubling the cases. As we are speaking now, we have crossed the figure of 600. And my particular state has maximum 122. But this has to be taken with a pinch of salt because the testing criteria were very, very strict, though some of them have been now relaxed just 2 days back. The latest figure of Indian Council for Medical Research, which is our primary agency, that we have only done testing only of 25,000 cases, of which more than 600 are positive, and we have 11 deaths.
Do you see the Indian healthcare system fit for receiving a higher number of cases which finally will have to come into hospital and some of which will need definitely then ICU treatment?
Absolutely not. There has been a perennial neglect of the public health infrastructure by successive governments, not only at the federal level but even at the provincial level. Privatization for last 3 decades has been the norm. And now it has been observed that the main burden which is shouldered by the public health infrastructure. Fortunately, because we are progressing slowly, the government has woken up and now certain measures have been put up. In my state of Maharashtra, now a new infrastructure, not new but by acquiring various infrastructure, 55,000 isolation beds have been made ready. But we are woefully lacking in number of ICU beds and number of ventilators. It is approximately, our main issue is data and exact statistics in our country of the health infrastructure. We have approximately 35,000 ICU beds and around 10,000 ventilators only for a 1.3 billion country population. Yeah. And considering that 5% patients would require ICU, 2% would require ventilatory support. God forbid the stage with which countries like Italy, Spain are there, India, if at all it goes there, it will be very difficult to handle.
Yeah, that means that this precautionary step was wise to be taken now and not to wait any longer for India. We have heard from many countries all over the world that there is a shortage of personal protective equipment, whether that is face masks, gowns, or gloves. Is that something you are experiencing in India as well now?
100%. Most of our frontline healthcare givers all across the country, even our premier institutions, are facing a severe shortage of PPEs. Plain, simple surgical masks are also not available, especially to those healthcare workers who are working in the field. We have multi-purpose health workers called as ASHAs, who around are 90,000 in number, and they are supposed to do contact tracings. Our paramedical staff working in laboratories, our ward boys, our doctors, and the main problem is of junior doctors and medical students. Most of the places, unfortunately, they are posted now in these newly created isolation wards, and they are not given adequate personal protection equipments. Fortunately, yesterday our Prime Minister in a nationwide address have sanctioned around $2 billion worth money for immediate release for the health infrastructure. We hope that coupled with the ban on exports, then the government has come out with a stricter law and bringing all these PPEs under the Essential Commodities Act, and lot of police action has started taking on black marketing and all such things. And everywhere now we are getting reports that uh, worth crores, lakh, millions of rupees, masks and PPEs are being confiscated, was supposed to be illegally sent outside India. Considering the vast poor people in our country, where it is very easy for us to advocate isolation within home, where in these areas there are 10, 12 people, family living in one small shanty or 1.5 rooms. Water which is used to wash hands is made available only after 2 or 3 days. So these unique issues need to be addressed. We are appealing to the community organizations. Unfortunately, the community and the voluntary NGOs which were working in floods, in earthquakes are not seen. One, because they don't know exactly what is to be done, and second, probably they are afraid to work in the field.
Yes.
But we are appealing to them to see to it that daily wage earners are given food, they are given sanitizers, soaps, water, all these things we don't know. But as of today, we hope, like you rightly said, that this lockdown should delay our curve so that we can definitely, and up till now it has been working properly.
So let's hope that this works. And what I would like to do is I would like to come back to you and do another interview maybe in a week or two in order to see how this has developed.
Thank you, sir. Definitely.
Thank you very much, Dr. Wankhedkar.
Thank you.